So by the end of this video today, I hope that you, if you have a mirror around, go and check out yourself. And I mean, in the best way possible. So here's the thing. As an athletic therapist, part of what I do in my assessment and reassessments are observe how the patient moves and functions. And a big component is what is going on. Your body is very much like Goldilocks. It wants to be balanced, okay? So when I'm assessing a patient, I'm looking at, is your body symmetrical? Did you know that if I can tell which side you're dominant for your hand, because that shoulder's gonna be lower down because you're using it more. Yeah, simple as that. So we can pick apart all these different things by just looking at your body. So I'm gonna teach you guys how to take care of yourself, or at least be aware of what's going on. This isn't gonna be for diagnosing anything at all, absolutely not. But it's more of awareness, so you guys know how to take care of yourself and be a little bit more educated. Because what I tell my patients is, I want them to be functioning on their own. I want them to be independent and take care of themselves, because I've given them the tools and educated them so they know how to take care of themselves. Okay, the whole point of athletic therapy is that you don't need us. We should be doing a good job that you know what, I don't have anyone coming in, okay? So it's true, and it's great because I get a revolving door of patients coming in, so when someone gets better, the next person's coming in. And that's how it should be, right? So let's keep up that good model. So that's one trick there with the whole shoulder thing. Okay, if you're, let's say, okay, a lot of people stand like so, okay? And they think that's good. Okay, so you're supposed to have a little bit of an angle, but not excessive like this. And the reason for that is, well, if your hips are externally rotated, which means they're turned outwards, okay? That means that for the most part, you're gonna have really tight butt muscles, okay? So you have your glutes, there's 3 of them, there's 3 butt muscles. They're pretty strong. They're your hip A abductors. They abduct and they steal your leg away from the midline of the body, okay? You have your hip A deductors, that are these guys here. And they're going to bring your leg to the midline of the body. So again, here we're gonna go back to that, that symmetry, okay? So with your muscles, you're always going to have your agonist and antagonist, all right? So one muscle is going to activate and the other one's going to relax to let go. And so if you have that muscular imbalance, that's going to cause you a lot of pain. So a lot of times if people are standing like this and they have hip pain or back pain or knee pain, well, it's pretty basic. It's pretty obvious where it's coming from, right? We have to get rid of those muscular imbalances. So we stretch out and massage and manipulate structures to get things moving, but then we also have to strengthen those weak areas to counterbalance what's going on and get rid of the pain, all right? Because we'll not get rid of it, we're actually resolving it, okay? So that's one thing there. So if you look in the mirror and your feet are out like this, your butt is too tight, okay? So we have to loosen up these structures here and then strengthen these guys here, okay? Now, if you turn sideways and look in the mirror, you want to make sure that you're balanced, so you're equal for your body positioning, okay? A lot of times I'll see people sticking their butt out, okay? And that's not comfortable, it's my back. Which is why people will feel back pain, because your pelvis, this is called an anterior rotation when we tilt forward for the pelvis, okay? A lot of people think that's good, and it's not, okay? Your spine is a nice straight line there, relatively, and if you rock your forward, if you tilt your pelvis forward like this, you're jamming the joint. So think of your body as a big giant puzzle, okay? You've got all these puzzle pieces that connect together, and if those puzzle pieces, if you just jam one in there, well, that's not gonna fit properly there, right? So everything in your body wants to be a nice flow, it wants to be balanced, and so we have to get rid of this, this increased arching in your back. It's called a lordosis, okay? So we don't want it excessively. We want natural curves, but that's different from a lordosis where we have a muscular imbalance, okay? So a lot of times, if your butt's sticking out, chances are you'll also notice that your neck and shoulders. Your shoulders will be rounded forward and your neck will pull forward. And the reason for that is your body needs to be balanced out with its weight distribution, okay? So if I tuck my bum in or if I lean my shoulders back, so just watch, if I bring my shoulders back, my bum will automatically tuck in. So for those of you, check in the mirror and see. If your shoulders are like this and your neck's like this, chances are your butt might be sticking out, okay? So your body is gonna find a way to be balanced, and your center of gravity is gonna change from being right in the middle when you're standing upright versus it shifting forward because your weight distribution is changing to balance out, okay? So if you're trying to get things moving, that is the simplest way to look at it. And for those of you who are kind of stuck and can't figure out how to move your pelvis, I'll put the link in the description for how to do pelvic rocking. You can try that out and see if that helps you out. So I'll leave you that with those couple of things there. I'm not going to try and blow your mind and do too much more, but look in the mirror and see, does everything look nice and balanced, or do you look like you're rounded or your butt's sticking out or your feet are turned out? Those are the simplest and easiest things to look at for your posture that you can address and take care of yourself, okay? So I hope you guys learned something, and you go and check yourself out in the mirror after. Okay, bye guys.